Carpal Scaphoid navicular fracture. Code 25622. Closed treatment of the carpal scaphoid navicular fracture without manipulation. Or code 25624. Closed treatment of a carpal scaphoid navicular fracture with manipulation. The physician treats a scaphoid fracture of the wrist without open surgery or manual manipulation in 25622. Separately reportable X-rays confirm the position and the alignment of the bone. In 25624, manipulation of the bone is required. The patient may require anesthesia. The physician manipulates the area by pushing on the wrist bones, particularly the scaphoid. The physician pulls on the fingers of the forearm, moving the fractured area back into position. Separately reportable X-rays confirm alignment. In both 25622 and 25624, a cast is then placed on the wrist and the forearm with the thumb spica to hold the fracture in position. Coding tips. According to CPT guidelines, cast application or strapping, including removal, is only reported as a replacement procedure or when the cast application or strapping is an initial service, performed without a restorative treatment or procedure. In 25624, local anesthesia is included in the service. However, this procedure may be performed under general anesthesia depending upon the age and/or condition of the patient. For radiological services, see codes 73100 and 73115. For radiological services, add modifier 26 to identify the professional component only, unless a physician owns the equipment. For the closed treatment of other carpal bones or fractures, excluding the navicular, see codes 25630 and 25635. Supplies when providing this procedure may be reported with the A4580. Check with your payer to determine coverage. Terms to know. Alignment. Establishment of a straight line or harmonious relationship between structures. Closed fracture. Break in a bone without concomitant opening of the skin. A closed fracture is coded when the type of fracture is not specified. Closed reduction. Treatment of a fracture by manipulating it into proper alignment without opening the skin. Fracture. Break in the bone or cartilage. Manipulation. Skillful treatment by hand to reduce fractures and dislocations to provide therapy through forceful, passive movement of a joint beyond its active limit of motion. Your codes 25622 and 25624.